So Dr. Paul here. So I get on my social media sites, which are Instagram and TikTok, if you want to join me there, and please subscribe to YouTube. And if you can tell your friends, we'd appreciate it. I get a lot of questions about diagnoses, especially now. The number one thing I see in my office is anxiety disorders. The number one psychiatric and mental health condition is anxiety disorders. So what's the difference? How do you know that? Well, it's different than just stress. Everyone, we all have stress. We all have bad days. We have good days. We have stressful things happen. That's just the normal state of, that's just being a human being. Anxiety disorder is different. It's basically anxiety to a level that doesn't make sense, So when it gets to the point where the anxiety is really controlling the person, and the symptoms typically are going to be racing heart, shakiness, shortness of breath, tightness in the chest. I think I might be having a heart attack. I think I might have to go to the emergency room. By the way, ER visits are very common with anxiety disorder. People who have a symptom, I'm going to die. I got to go. So basically, I talk to ER doctors and they say, oh yeah, more than half of what we see is anxiety related. So it's a very big thing. And how does anxiety present? Well, like I just said, but also the physical things. Like I said, pain, muscle tension, neck, shoulders, back, stomach, acid reflux, irritable bowel syndrome, fibromyalgia, chronic joint pains. So there's a lot of tip-offs for anxiety, and a lot of the tip-off is the physical element. So a lot of my practice, has been about the connection between the mind and the body, the physical and the emotional connection. And we see that with anxiety. So what to do about it? Well, basics to start with is, are you getting enough exercise? Because if exercise can definitely help anxiety disorders quite a bit if you're regular with it. Something cardiovascular, like walking, like rapid walking, jogging, go to the gym, whatever. I like to walk. I'm a walker, and that's walking is a great exercise. But something like that to lower stress level. Is there something in your life that's causing stress that you need to change? Is there a relationship problem? Is there whatever? So we got to also focus on what actions we can take that we can control. At the end of the day, though, sometimes it's something we can't control because it's a chemical, neurological, medical thing going on, and that's what creates. So when the anxiety gets into that point where you're having all these symptoms, you're having panic attacks out of the blue. Usually they happen for no apparent reason. They're not happening because of a situational stress. They just pop up out of the blue, and they scare people because it's not a pleasant condition to have. It's very uncomfortable and it's miserable. And so, anyone who's had a panic attack can attest the fact that it's no fun to go through the panic and anxiety attack. So medications really are extremely helpful with this condition. So I can tell that when someone, like I said, crossed the line from the mild situational stress to a more pervasive, continuous problem, that's what anxiety disorders are. It's not like always 24/7 either. It can come and go. And some people can identify things that can cause it. Like the most obvious things that cause it would be public speaking is number one, flying is number two. Those are the two biggies right there, but there's other ones, elevators, claustrophobia, fear of heights, etc. But when anxiety kind of crosses that line to the point where it's really negatively affecting a person's life, then that's where we act. And I'm always looking I'm always thinking chemically. With anxiety disorders, my number one is an SNRI. So the medication that works on serotonin and norepinephrine, usually better than an SSRI alone for anxiety. Very effective. If it's not, the other, I look at norepinephrine, I look at GABA when it comes to anxiety in particular. So with SNRIs, we got Pristiq, Effexor, Cymbalta. With GABA, we got Topamax, we got gabapentin. So these are those. Like I said, anxiety. Those are two. But serotonin can be involved. Dopamine can be involved also. So it takes a little bit of figuring out. But anxiety disorders are actually fairly easy to treat. You just have to know how to treat it, and you have to get the people to understand that this is a chronic problem you're having, and that's why you need to take it. Will I have to take it every day? Yes, you should. can I just take Xanax? And people want to just I call Band-Aid treating, where they just treat the surface symptoms. And then but I tell them, look, if it won't stop the cycle, just keep it going. You're just putting a Band-Aid on top of it. Let's just treat this to the point where you don't need that, or you need that very rarely, or some people are taking it frequently. At least cut down the use of that by actually treating the core symptoms and not just trying to cover it up with a benzo, which is a tranquilizer. So that's why it's a really important, because it's such a common condition. It's very undertreated. Sorry to say, most doctors don't understand this basic, I just said, and they don't treat it that well, or people get turned off with side effects, and the doctor doesn't explain the side effects. Anyway, there's a host of reasons that stand in the way of people getting help. Go to someone who you trust. Go to someone who knows what they're doing. Come see me. My practice is open. You can patients can see me if you want. I do see people virtually also if you're not in my area. Anyway, but we can talk about depression and other things, and there's a lot of common diagnoses I see, but definitely anxiety disorders is number one.